Understanding how psychiatric hospitalization typically occurs can reduce fear and help you feel more prepared if you or someone you love needs this level of care. There are generally two main paths to admission, each with different experiences and levels of choice involved. When someone calls 911 for psychiatric emergency, it triggers a coordinated response designed to get you safe medical care as quickly as possible. The process can feel overwhelming, especially when you're already in crisis, but understanding what happens can make it less frightening. Police officers typically accompany EMTs to psychiatric emergency calls, but this doesn't mean you're in trouble or have done anything wrong. This is standard safety protocol for mental health emergencies, designed to protect everyone involved, you, the EMTs, and any bystanders. Most police departments now provide crisis intervention training to officers who respond to mental health calls. This training teaches them to approach people in crisis with understanding rather than force, to de-escalate tense situations, and to recognize that you're experiencing a medical emergency, not committing a crime. EMTs are trained both in medical and mental health emergency response. They'll assess your immediate safety, check your vital signs, and ask questions about what's happening and how you're feeling. They're not there to judge or interrogate you. They're gathering information needed to get you appropriate care. The responding team will ask questions about your current mental state. Are you thinking about hurting yourself or others? Are you hearing or seeing things that others can't? Do you know where you are and what day it is? These questions help them understand your immediate safety needs and level of crisis. They might ask about medications you're taking, substances you've used, medical conditions you have, or recent events that might have triggered the crisis. Honest answers help them provide the safest and most appropriate care. If there's immediate risk of harm to yourself or others, they might need to use restraints during transport to the hospital. This isn't punishment. It's purely for safety during a time when your judgment might be affected by your mental state. The restraints are removed as soon as it's safely possible. The ride to the hospital can feel surreal and frightening. You might feel embarrassed, especially if neighbors witness the emergency response. Remember that seeking emergency care for mental health is just as valid and necessary as calling an ambulance for a heart attack or broken bone. The EMT riding with you will continue monitoring your condition and might ask additional questions about your symptoms, medical history, or emergency contacts. They're trained to provide calm, supportive care during transport. The hospital team will be expecting you based on radio communication from the EMTs, so your arrival will be coordinated and the staff will already have basic information about your situation. The alternative path involves going directly to a hospital emergency room for psychiatric evaluation. This route often feels less chaotic and allows you more control over the process, though the end goal, getting you safe, appropriate care, remains the same. You might recognize that you need immediate help and choose to go to the hospital yourself. This demonstrates significant insight and courage, acknowledging that you need more support than outpatient therapy can provide, and taking action to keep yourself safe. You can drive yourself if you feel safe doing so, or ask a trusted friend or family member to take you. Having someone accompany you can provide emotional support during a frightening experience and help advocate for your needs if you're having trouble communicating clearly. Sometimes your therapist, psychiatrist, or primary care doctor might recommend immediate hospital evaluation based on what you've shared in appointments or conversations. They might offer to call ahead to the hospital to explain your situation and arrange for direct admission to a psychiatric unit, potentially bypassing some of the emergency room waiting. Mental health professionals are trained to recognize when outpatient treatment isn't sufficient for your current level of crisis. Their recommendation for hospitalization comes from clinical experience and a genuine concern for your safety, not from wanting to get rid of a difficult patient. If you have time to prepare, bring identification, insurance cards, and a list of current medications. Comfortable, loose-fitting clothes without drawstrings, belts, or metal hardware are ideal. Slip-on shoes work better than shoes with laces. You might want to bring a few comfort items, like photos of loved ones, a journal, or a book, though the hospital will need to approve these items for safety. Don't bring valuable items, as secure storage may be limited. Having emergency contact information readily available helps staff notify people who need to know about your hospitalization and can provide support during your stay. The admission process can feel like a blur when you're already in crisis. Your mind might be racing, you might feel numb, or you might be struggling to think clearly. Understanding each step helps you know what to expect and feel more in control during a time when everything feels chaotic. Whether you arrive by ambulance or walk in, you'll start in the emergency room. The triage nurse will ask about what brought you to the hospital and assess your immediate risk level. Questions like, are you having thoughts of hurting yourself? And do you feel safe right now? Help them prioritize your care. Emergency rooms can be overwhelming environments. Bright lights, constant noise, unfamiliar smells, and lots of activity. When you're already in mental health crisis, this sensory overload can feel unbearable. Staff understand this and will try to place you in a quieter area when possible. You might wait before seeing a doctor depending on how busy the ER is and how they assess your immediate risk level. This waiting can feel endless when you're already in crisis. But staff are monitoring you regularly and will intervene if your conditions change. Nurses will check your blood pressure, heart rate, temperature, and oxygen levels. These vital signs help identify any medical issues that might be affecting your mental state and establish baseline measurements for monitoring your condition. They'll ask about your medical history, current medications, allergies, and recent substance use. This information might feel irrelevant when you're having a mental health crisis, but physical and mental health are closely connected, and this information is crucial for safe treatment. Be completely honest about substance use, even if you're embarrassed or worried about judgment. Medical staff need accurate information to provide safe care, and they're bound by confidentiality laws. They're not there to judge, they're there to help. Before you can be admitted to a psychiatric unit, doctors need to ensure that your symptoms aren't caused by medical conditions and that you're physically stable enough for psychiatric treatment. Blood tests might check for infections, thyroid problems, vitamin deficiencies, blood sugar irregularities, or levels of substances in your system. These conditions can all cause or worsen psychiatric symptoms, and identifying them changes your treatment plan. Urine tests can detect substances that might not show up in blood tests or might indicate kidney problems. If you've had head trauma recently or are showing signs of neurological problems, they might order CT scans or other imaging studies. Some physical conditions can mimic psychiatric symptoms. Thyroid disorders can cause depression or anxiety. Certain infections can cause confusion or agitation. Brain tumors, though rare, can cause personality changes or hallucinations. Medical clearance ensures you get treatment for the right condition. A doctor will conduct a physical exam, checking your heart, lungs, abdomen, and neurological function. They're looking for signs of medical conditions that might be contributing to your mental state or that might affect your psychiatric treatment. This examination might feel intrusive when you're in mental health crisis, but it's a necessary part of comprehensive care. The medical team needs to understand your complete health picture to provide the safest and most effective treatment. Once you're medically cleared, a mental health professional will conduct a detailed psychiatric assessment. This evaluation forms the foundation of your treatment plan and helps determine whether hospitalization is necessary. The clinician will ask detailed questions about what's happening right now. What thoughts are you having? Are you hearing voices or seeing things others can't? How long have you been feeling this way? What triggered this crisis? They'll assess your mood, thought processes, perception of reality, and level of insight into your condition. They're trained to recognize signs of various mental health conditions and to assess how severely they're affecting your functioning. This conversation might feel overwhelming or repetitive if you've already answered similar questions, but each professional is gathering information for their specific role in your care. The emergency room doctor focuses on immediate medical safety, while the mental health professional focuses on psychiatric treatment needs. The most important part of the evaluation involves assessing your risk of harm to yourself or others. The clinician will ask direct, specific questions about thoughts. Have you thought about yourself? Have you made specific plans? What's prevented you from acting on these thoughts? They'll also ask about thoughts of harming others. Are you angry at specific people? Have you thought about hurting anyone? Do you have access to weapons or means of harm? These questions can feel uncomfortable or invasive, but they're absolutely necessary for determining the level of care you need. Honest answers ensure you get appropriate protection and treatment, not judgment or punishment. The clinician will assess your understanding of your condition and your ability to make safe decisions. Do you recognize that you're experiencing mental health problems? Do you think you need treatment? Can you keep yourself safe if you go home tonight? This assessment isn't about testing your intelligence or rationality. It's about determining whether your current mental state allows for safe decision making about your own care and safety. Based on the comprehensive evaluation, the treatment team will decide whether hospitalization is necessary, and if so, whether you can be admitted voluntarily or need involuntary commitment. Voluntary admission means you agree that hospitalization is necessary and consent to treatment. This is always the preferred option because it means you're actively participating in your own care rather than having treatment imposed upon you. When you're admitted voluntarily, you maintain more rights and control over your treatment decisions. You can participate in treatment planning, request specific accommodations when possible, and maintain more autonomy within the safety constraints of the unit. Voluntary admission doesn't mean you can leave whenever you want. It means you agree that you need to be there and will work with the treatment team. If your condition changes and you become unsafe, your status might change to involuntary, but this requires additional clinical assessment and documentation. Involuntary admission happens when the clinical team determines you're a danger to yourself or others, and you're unable to make safe decisions about your own care due to your mental state. I know this feels devastating. It feels like your rights are being taken away, like you're being punished for being sick, like you've lost all control over your own life. These feelings are completely understandable and valid. But involuntary commitment isn't punishment. It's medical protection designed to keep you alive when your mind can't make safe decisions. Just like doctors wouldn't discharge someone having a heart attack who wanted to leave against medical advice, mental health professionals can't discharge someone who's actively suicidal and unable to maintain their own safety. Involuntary commitment has strict legal requirements that vary by state, but generally require that you be mentally ill and dangerous to yourself or others, and unable to care for yourself or make rational decisions about treatment. Even when you're involuntarily committed, you retain important rights. You have the right to legal representation, the right to appeal the commitment decision, and the right to have someone contacted on your behalf. You have the right to be treated with dignity and respect, to receive appropriate medical care, and to be held in the least restrictive environment consistent with your safety needs. Hospital staff should explain these rights to you, usually both verbally and in writing. Many hospitals have patient advocates who can help you understand your rights, navigate the system, and ensure your voice is heard in treatment decisions. Don't hesitate to ask for an advocate if you need one.